Welcome to ABC Tutorial. Today we are going to talk about folate deficiency. Folate is the naturally occurring form of vitamin B9. Its name is derived from the Latin word folium, which means leaf. In fact, leafy vegetables are among the best dietary sources of folate. The active form of vitamin B9 is 5-methyl tetrahydrofolate, 5-MTHF, also known as levomethylfolic acid. Folic acid is a synthetic form of vitamin B9, also known as pteroyl monoglutamic acid. Folate deficiency can lead to anemia, birth defects, sores on the tongue and inside the mouth, a change in color of the skin, ear or fingernail. The common causes of folate deficiency can be remembered by using the mnemonic, a folic drop. This stands for alcoholism, folic acid antagonists such as sulfonamides, trimethoprim and methotrexate, oral contraceptives, low dietary intake of folate, infection with Giardia lamblia, celiac sprue, dilantin, which is the brand name of phenytoin, relative folate deficiency, old age, and pregnancy. These are the causes of folate deficiency.